the greater subject build positive and respectful relationships with the original inhabitants of this land, including First Nations peoples, Métis people, and Inuit. It is in this spirit that we as a service honor and acknowledge that we serve in this land that is cared for from time immemorial by the Anishinaabe people of the Three Fires Confederacy. We further acknowledge this land as the dish with one spoon and the Robinson Huron Treaty Region. In peace, our first duty.
Thank you, Member Sizer. Roll call. Sharon, you have eyes in your head. You know we're all here. Declarations of conflict of interest. Hearing none, we go to our agenda. As chair of our board, I thought it was important that we call this special meeting today. With regard to our local media, welcome Tyler, by the way, thank you for coming this morning. Other medias as well, and I would call it a community conversation, that there's some concerns about exactly what is being done with regard to a series or litany of problems, homelessness being one, vagrancy being another, issues of vandalism, open drug use, etc. In doing a little bit of my own research, I think that in fact GSPS and others in the community are doing a relatively good job, but I'm not sure that narrative is being shared. So I thought this morning it would be very important that we get an update from GSPS with our Chief Cunningham as the spokesperson for that. Also, we'd like to welcome today David McNeil, CEO of HSN, and Dr. Rita Coca, one of the leaders in mental health. They are definitely our partners with regard to these issues, and perhaps their voices today can kind of have a synergy of making a difference and helping people that need the help. So with that little bit of a overview, I just open to the board members. Do you have anything you want to add to that?
No, that's great.
Krista?
No.
Sean? Paul? Paul, like the leader in the meeting, we'll call upon you as the mayor to kind of give your ideas about what we're doing today as well. So I turned it over to Chief Cunningham. Chief, to give the board and our community, by the way, for the benefit of everybody in the room, especially since we've got such a good gallery behind us, some of you are new. The mandate of our board is to make sure that policing is adequate and effective in our community. That is the legislative mandate of our board, and therefore, by calling this meeting, we're basically just doing a bit of a temperature test to make sure adequacy and effectiveness is being done in our community to the best of our abilities. Now over to you, Chief.
Yeah, thank you, Chair, and I can assure you of that. So good morning, everybody. Chair Lougheed, members of the board, our media partners, and most importantly, I want to acknowledge our members. I want to begin by acknowledging something that is very clear from our conversations with our residents, our business owners, employees in the downtown, service providers, visitors to the greater Sudbury area, is people care deeply about this community. They care about the downtown, and they continue to have legitimate concerns about safety, social disorder, open drug use, property crime, and the quality of life. And those concerns are real. And I look to our community response team here that are in the downtown every day and hearing those concerns. And they are important, and they deserve a thoughtful response by us, the police. And while these issues we are seeing are not unique to our community, that doesn't mean that they are any less important or they lessen our responsibility to address them. I want to provide context today around the work that we are doing here at the Greater Sudbury Police Service, the progress we've seen, and the challenges that continue to exist. And communities across Ontario, like I said, and Canada continue to face the impacts of homelessness, untreated mental health challenges, addiction, and we know the toxic drug crisis. These issues have placed significant pressure on healthcare systems, on social services, on municipalities, on businesses, and police services alike across the province. Officers are frequently responding to situations where the underlying need is housing, healthcare, withdrawal management, treatment, or crisis stabilization, but appropriate services or placements sometimes are just not available. Police are then left managing the immediate symptom without having the tools to resolve the underlying problem. This causes significant frustration for our team. Again, I want to clarify what our role, the police, is in this crisis. Our officers have two legislative authorities in which they can use. One is to arrest an individual and bring them before the courts if a crime has been committed, or we can apprehend them under the Mental Health Act if they are a danger to themselves or others. The reality is that many of the situations our officers encounter daily falls outside both of these legislative frameworks, and people are struggling with complex social needs, often do not meet the legal criteria for either an arrest or an apprehension. These are deeply human challenges that require health, social services, and community-based responses alongside policing. As police leaders, we recognize that enforcement alone cannot solve these challenges we are seeing. At the same time, our community expects us to address criminal activity, respond to disorder, and ensure public spaces remain safe and accessible for everyone. That is why the approach that we have focused on is balancing public safety with compassion, accountability with support, and enforcement with prevention. Over the last 2 years, hopefully, our community has seen the significant increase in police presence in the downtown core. We have a dedicated downtown strategy. We have conducted thousands of focus patrols, both on foot and on bike. Those patrols are simply not about visibility. We know that. They create opportunities for officers to engage with residents and businesses, identify emerging concerns, intervene early, and connect vulnerable individuals with supports. Our community response unit, patrol operations, our drug enforcement unit, our integrated crime section have worked together to address criminal activity through intelligence-led policing and targeted enforcement. Hundreds, and this board knows this, hundreds of arrests have been made. The execution of numerous arrest warrants for wanted individuals, the seizure of significant quantities of fentanyl, methamphetamine, cocaine, crack cocaine, and other illicit drugs. From January 2025 to date, we have seized over 3.7 million in drugs from our streets, along with another 1.9 million last June in a joint project with our OPP partners. And despite our commitment and ongoing efforts to disrupt the toxic drug supply in our community, we continue to see drug traffickers come into our community and exploit our vulnerable population. We've also removed weapons from our community. We've also disrupted organized crime and held offenders accountable who engage in drug trafficking and other criminal activity. Importantly, these enforcement efforts are focused on criminal behavior and individuals who present elevated risk to public safety. And they are not directed at criminalizing homelessness, addiction, or others suffering from mental health. One of the most important aspects of our approach here at GSPS has been a commitment to connecting people with support before turning to enforcement when circumstances allow. Daily, our officers in the downtown are using initiatives like high visibility and community outreach, support first, and officers, along with many of our community partners, some whom are here today, outreach teams, healthcare providers, community organizations connect individuals with housing supports through our city partners, through client navigators, addiction treatment services, food resources, crisis response teams, and homelessness services. In just one outreach, officers engaged over 7,000 community members and facilitated 1,400 referrals. That work reflects simply a principle: where support is appropriate and available, we will lead with support. But let's be very clear today. Policing is only one part of the solution. Many of the underlying factors contributing to public disorder stem from issues that fall outside of our mandate of law enforcement. Housing, addictions, treatment, mental health, income supports, and social services are critical components of a long-term success. And this is why collaboration remains paramount and essential. This is not something solely a policing issue. Meaningful improvements require municipal partners, health, housing, social services, justice, community partners for a coordinated response. So again, we continue to work extremely closely with our partners. We met just this week with downtown partners, the BIA being one. We meet with many, many businesses in the downtown core to listen to what they are seeing. The progress we have seen reflects collective efforts. So these improvements do not mean challenges have disappeared. We've seen significant improvements in the downtown. Thank you to our city partners. We see cleanups. What I can tell you is that sustained coordinated efforts can make a difference. Lastly, as your chief of police, I want our community to know 3 things today. First, we hear the concerns. Second, we are taking action through enforcement, through prevention, through visibility, through outreach, and through partnership. And third, we remain committed to working alongside our partners and doing our part. Many will often hear from me, we will be part of the solution. And we will work with our community partners to address the symptoms and the root causes of the issues affecting our downtown core. Our officers sometimes deal with the same individual multiple times in one day, sadly just moving them from one area to another. We need sustainable solutions. We need supports for these individuals. Public safety and community well-being, we know, is a shared responsibility. So today, lasting change will take many of us to be rowing in the same direction. A downtown that is safe, welcoming, healthy, and inclusive for everybody. So again, I want to thank our members who are out there on the daily. They know I watch often from my window. I listen to our radio. They are out there making a difference. And just this morning, I watched at the corner of Brady here an arrest of an individual wanted on outstanding warrants. So from me to the members of GSPS, thank you for your continued dedication, your professionalism, and working diligently to make our community safer.
Thank you, Chief. Excellent presentation. A lot of very good positive information, because this is a negative issue with regard to not just our community, but likely our country as well. So the fact that your leadership and your commitment is very much being reinforced by your team, and it is making a difference as a board, we very much feel that's adequate and effective. But having said that, I'll let the board members question or comment, starting with you, Member Sizer.
Thanks, Chair Lonnie. What your comments near the end, Chief, was with respect to the gangs that are here that have infiltrated our community. Can you tell, or do we have any data on whether they're local or external, or they're being imported in here to as a new market for them, or are they local? And second to that, if they are external to us and they are arrested, do they become our responsibility, or do they become, if they're from the Toronto, the GTA area, does it go back to that jurisdiction?
Yeah, thank you through you, Chair. As the board knows, many of our significant drug seizures, as well as our homicides or weapons, are those coming from the GTA, not from our municipality here. So if arrested here, they do come back here for court, but hopefully the police of jurisdiction are checking their bail conditions. We know in our June meeting, we had our bail compliance and warrant apprehension team here. So if they are in our jurisdiction, we are checking their bail conditions, but a lot of times they go back to the municipality where they came from. Like, drugs are not being, what's the word I'm looking for? Produce, thank you, somebody, produce, thank you. Locally, we know it's coming into our community, and sadly, and our team here, drug team that's here is, once we, make these multiple arrests, significant arrests, the next individual is here to deal those drugs. We have a vulnerable population with, as we know, an opioid crisis, so they're here preying on those individuals.
Thank you.
I don't really have any questions. Just a comment. My office is near the downtown core. I'm in the downtown core fairly regularly for work. I've noticed significant changes and improvements. So great job. I've been in other communities. Their downtowns are similar. It's a challenge facing numerous communities across Canada. I liked your comment with respect to support first. These individuals that you deal with on a regular basis, daily, more than once daily. I think we need a resolution that is based with support from many factors in this city. And we have a few here to comment as well, which I'm looking forward to their comments. So I think overall, great job.
Thank you.
Member Poland.
Great comments, Chief. Thanks very much, and thanks for the great work the team is doing. You mentioned the BIA, which is one of the many important partners. So what were we hearing coming out of that meeting from members of the BIA? What were some of the supports that we have been putting into place in working with the BIA in order to, frankly, help keep business moving in the downtown core?
Yeah, thank you for that. Through you, Chair. I know Matt and Sherry here today. They regularly meet with Jeff and his team and Kendra from the BIA. We met with them this week. We met with the owner of 40 Elm this week. And it's such a great relationship. It's like pick up the phone. This is what we're seeing. Same with our city partners. So we're working collaboratively. Often they'll see things before we see them, and so we'll go out and address them. So I think again, those strong partnerships and just keeping the lines of communication open and finding solutions and working together. I know one of the things that was really great was the welcoming streets. And it was originally, I think, through the city and then the BIA last year. It's no longer. We're seeing kind of that. It was good for us. It was a lot of calls went to the welcoming streets before it came to the police service. Again, with those individuals that are looking for support, and you don't need 2 police officers to show up. Acting Deputy Brunette and myself and many of the inspectors have been out in the downtown core the last several weeks, walking along. And just for kind of context, the 3 kind of calls that the deputy and I engaged in, EMS was there, fire was there. It was all health related calls of individuals. We did not need the police there. So it would be great if there were some supports, and that's where the BIA is giving us a lot of intelligence led information to help us better support the downtown.
You also mentioned, and we know this is not a localized problem. I'm sure this is a discussion amongst other chiefs of police. What are we hearing from across the province? And is there any advocacy work that's happening coming from the chiefs?
Yes, and thank you through you, Chair. There is, and again, what we continue to say is this is a health crisis. And the police are being part of the solution. And as you know, we have our mobile crisis rapid response teams. Throughout the province, there's many different teams. I believe Windsor calls it the coast model. At the end of the day, the police should not be responding to many of these calls. The perception of safety is why police are there. But again, we continue to advocate to government for asking for more resources to be able to properly address this, like I said, mental health crisis, this drug crisis, to allow us to better serve the vulnerable population.
Sean, anything else?
Not yet.
Member LaFave?
Thank you. Great presentation, Chief. You and I have talked about this on many occasions, and thank you, Chair, for bringing us forward this morning. A few comments and a few questions for you. It's interesting the difference between the hardcore criminals that are preying on the vulnerable, dealing with them, drug seizures, and the amount of value that we've seen within the last 7 months. It's been 8 months almost. It's been staggering when we tally all those together. So thank you to the team at GSBS. You guys are doing amazing work, and thank you on behalf of the community for that. Now, the population that is more challenging is that vulnerable population that's being critical. Often people in the community say, well, they should just be, if they are bringing social disorder, they should be put in jail. But once they're released from jail, that's my question. My first question to you is, if they are committing a crime and they are sent to jail, once they leave jail, what happens?
Yeah, so through you, Chair, once they leave jail, a lot of times, and we've seen individuals get a 30-day sentence and come back out, and they're back to where they were before. They're back, if they were previously living at Energy Court, they're back at Energy Court. And sadly, we see it with, the hospital as well.
Yeah.
We've had some of our officers administer naloxone at 8 a.m. and by the time they're leaving to come at the end of their shift, that individual is back walking downtown. So yes, unless there are further supports for these individuals, the system will continue to cycle.
Yeah, that's the point that I'm trying to get to, is that we're just right now those vulnerable population, because even though the system right now that I understand, and certainly we'll have our experts after in the healthcare sector advise us on this, but is that they can make their own decisions, even though they're not well, right? They can keep making their own decisions. They don't want to get help. They don't need to get help. And they are not, help is not, not provided to them if they don't want it. But even for some that want to get the help, sometimes the system is overwhelmed and they can't help everybody that actually needs it. So that's where I see the issue lying right now in the vulnerable population that want to get help. Right? We have the Lotus program. It's full. There's a waiting list, and we're applying, as you know, for more funding from the federal government and the province have more beds. That being said, the hard population is the one that don't want to be helped. And they want to continue that unfortunate lifestyle that basically is bring that social disorder. And that's where we all know that's where the crux of the issue lies, of providing them help, because that's what they need. They don't need jail. Jail will not, may help them for a few weeks to maybe need to clean up, and after that, so they're back on the streets. So we're just cycling. So how do we make sure that they get the help that they need when they need it, which is now, because they are a harm to themselves.
Mm-hmm.
And that's what we're seeing more and more, because this social disorder is what prompted you, Chair, to call for this meeting. So with that, I think it's maybe a good segue to our friends from the healthcare sector, maybe provide us with their thoughts on what their capacity is and their lack, because there's a gap in the system. There's no doubt about it. We're not the only municipality dealing with this, as we just heard many, many times now. There's major gaps in the healthcare system. This is the biggest crisis in our lifetime that we've ever faced. People are basically addicted. The system is not there to help them out. There's not enough recovery beds. We need to have a full-on approach of recovery first for them to help them getting out of that. But right now, from what I understand, we don't have enough capacity in our system in this province. Other provinces are doing other things. So maybe with that, we can ask our friends, Chair.
Good suggestion, Member LeVay. Just before we go to, maybe David will have you be up first, if you don't mind. The question that Member LeFave asked about the jail, help me a little bit with what this issue, a regional jail is. Because it's not just Sudburyans, is it?
No, and so sometimes individuals do come to the Sudbury District Jail and are incarcerated here. And are they released into our community and stay? I would suggest maybe our team over here might know. But at
Which,
the
by
end,
the way, there's nodding heads over
yes,
there.
there's nodding heads. That is, I know we've talked about this a lot. Individuals have come from other jurisdictions that come and are unhoused here. But we've seen over the last several years, sadly, we talk about the working class poor. We've seen individuals, most recently, Siberians that are out in our community that are unhoused now. And sadly, we recently talked about that this week is, and I drive in shortly after 7, and you see individuals now walking through the downtown with their suitcases, because those that go to shelter in the evening are released every day into the downtown core, and they access services throughout the downtown. And generally, most of those individuals aren't the ones we're getting called. But again, it increases, those just kind of, throughout the downtown core throughout the day. And, I've spoke with our city partners. Right now, we do see kind of some of the services, throughout. So they have to move around the downtown already. But we are seeing an increase. It's not just individuals coming from other municipalities.
The reason I raised the question, Chief, is that in the community, there is this almost urban myth that other communities send people to our community because we supply such good resources, and that in fact, even the people coming out of jail, there's no system. And looking at the experts on this side of the room, they don't get a bus ticket back to where they came from. The Crown or the courts don't tell them they have to go back where they came from, so we inherit them. Is that correct?
That is correct.
Okay. We'll come back to that a little bit later on, but now we very much thank our CEO of HSN. As you heard the mayor and you've heard our comments so far, David, you are obviously an important partner. So can we hear from you?
Sure. Well, first, thank you for the opportunity to be here and have this discussion. This is a complex social issue. It is not a policing problem, not an individual organizational problem. It's a complex social issue. And, it's an issue, mental health and addictions are issues that impact individuals first. They impact families, and families that of individuals who are suffering mental health and addictions are suffering significantly as well. And it clearly is impacting our businesses and, the broader community at large. And that's the pressure that I think the Services Board feels as it relates to this issue, is that community pressure. I just wanted to take the opportunity just to say thank you to the Police Services Board for your great leadership in this issue. Chief Cunningham, thank you very much for your amazing leadership. And my observation is that as we look at our community compared to other communities, the collaboration that we have with our police services, with our city, is unprecedented. Is not something that we see across communities in Northern Ontario and in broader Ontario. The access issue, HSN very much supports improved access to assessment, to treatment for mental health services and addictions related issues, as has already been identified, getting access to recovery services, supportive housing remains a significant challenge. We know that the clinical evidence demonstrates that if we can get access to supportive housing, we see significant opportunity for improvement and intervention clinically with those individuals. And it's ironic that something like mental health and addictions, the solution often revolves around getting access to supportive housing. A home, a safe place to live, is, as identified, very significant. The issues that we are working on as a community that I think are just unique, and really highlighted across the province. Things like the Locust program, as Mayor LeVay has already identified, that partnership with the City of Greater Sudbury and HSN to provide not only the housing component, but the treatment component for those individuals has demonstrated significant opportunities for us to improve access to care and improve the outcomes for those individuals suffering. So I think, is there a magic solution? We've talked about some of the pathways. What do you do with an individual who presents to the emergency department? Through our community drug strategy, we are working on a substance abuse pathway that looks at individuals who to present to the emergency department. And what is the pathway that we can actually improve access to community-based services? So those individuals, so we can try to break that cycle out. Well, this is the third or fourth visit to the emergency department today. And they're back out on the street, they're picked up by the police, and they're brought back to the emergency department. We're trying to work in those pathways. For some individuals, there is going to be, those things will work if we can get access. And for other individuals, there is going to be a very difficult population that won't work. Same thing with corrections and the substance abuse pathway. We've begun to look at, what do we do with individuals who are incarcerated and are leaving jail after 30 days? That pathway is not well articulated. So I think we need to continue to work through that through our community drug strategy, and that's where that work is being done right now. So I think those are the things that we can do. I just also wanted to highlight, when I co-chair the Ontario Hospital Association Mental Health and Addictions Committee. And one thing that's clearly evident when it comes to mental health and addictions, particularly in the addiction-related issues, there is a marked divide between North and Southern Ontario. In Northern Ontario, the opioid-related death rate is 3.3 times that of the provincial average. So our police services is not only dealing with what the rest of the province is dealing with, the challenge is 3 times bigger. And so I think we need to understand the context in which our police services are really the challenges that they're faced with our communities faced with. But it's very much a northern-southern divide on this issue. So I think that's an important context to also recognize. I don't know if there's any other specific questions that you would have of me, but those are the things that that we can offer right now. And HSN is very much committed to working with patients. Of course, we run a very large inpatient mental health and addiction service, as well as a significant outpatient on mental health and addiction services. But as identified, access to treatment, access to assessment and treatment remains an issue, limited by and program support. So
Thank you very much, David. Just on behalf of the board, thank you for coming today. I know you have very busy schedules and you've been off for a few days, so this commitment is very much appreciated. As I'm sitting here, I'm thinking, let's see, Sarah Cunningham grew up in our community and David McNeil grew up in our community. Very valid voices that understand our culture, understand our challenges, and the fact that 3 times as many problems in Northern Ontario to Southern Ontario, that is a cottage industry for me. That's how we got the Cancer Centre built in Northern Ontario, because we have special needs, and you, as leader of HSN, identify with that and help with that. So thank you, David, for being here, and thank you for who you are and what you do. No, don't leave yet, though. Okay. Al, you got anything?
Yes, Chair, thanks, David, for that information. This is more of a comment, I think, than a question for you and that type of thing. But you did mention, and again, has been mentioned before, incarceration for 30 days and then, but while they're during that incarceration, there's no support for them as far as their addiction or their mental health that is there. So as a comment to myself, I really, and you also talk about access to treatment and funding, and I really feel, as has been mentioned, 2, 3, 4 times a day, the same individual gets picked up by our service and ends up at your facility. I really feel that there was a real injustice done to these people when the Sub-Algoma Sanatorium was closed. I believe it was Mr. Harris that closed the SAN back a few years ago. And for exactly what you pinpointed, when the police service apprehend an individual, they take them to the hospital and they're out within a couple of whatever the time. At least with that other facility, there was a chance that they would get assessed and get support. I'm not saying the assessment is not there. It's the treatment that's not there. They're not held and assessed and treated for whatever their addiction or issue is. So you guys are doing a great job as best you can. We know that it's a regional hospital. We talk about regional jail. It's a regional hospital. We deal with more than just our local individuals. You are a center for the North. And so it's difficult, but we do appreciate your work, and we hope we can continue to advocate for more assistance for these individuals.
So I just want to, when we did consolidate, the number of beds did change between and we still actually have 29 patients over at the old Algoma site. We share that site with North Bay. And that's always an ongoing issue.
Yeah, not on today's agenda, David, so moving right along.
And of course, I'll put in a plug that, a key part of our expansion as we look to the future at Health Sciences North is mental health and addictions, consolidating those beds, but also increase the number of beds for patients with mental health and addictions issues. We run a very unique program at Health Sciences North that's pretty unique in Canada. It's called our Addictions Medicine Unit. And it is simply for patients that are addicted because they have medical problems. They might have a cardiac problem, an infection, whatever. We have a unit that is 22 beds. And in that unit, we know that those patients are users. It presents its own challenge for us as an institution. But we also are providing the medical interventions that those patients require, whether it be infections, whether it be cardiac related issues or other problems. That's pretty unique in all of Canada. And we're evaluating this. We do research on this to see its effectiveness so that we can share that learning with the rest of the country. So we are leading the way in many aspects of those things, taking some chances and trying to do things a bit differently to see if we can serve those patient populations. So, I think we are using the resources that we have available to the best of our ability and trying to treat these unique challenges. Do we need more? Absolutely, we need more. getting timely access to assessment, to treatment, and then the supports that need to go beyond that, because, you know, as much as you can assess and treat, if we're bringing people back into that, that same environment, they're just going to rebound.
Good, Al?
Yes, thank you.
Krista?
No, great information. I'm kind of shocked at the north-south divide. I knew there was a divide, but to that extent, no. So there really is a challenge.
Member Poland?
David, appreciate you taking some time to be here today. Appreciate the good work that you and your team are doing. The north-south divide is something that landed hard and heavy on this side of the table as well. So very good information to have. I think during your comments, you talked about no magical solution. If you did have a magic wand, what would be the first thing you would, from your perspective? I know you have lots of challenges at the hospital, but on this particular issue, if you did have a magic wand, what would the first implementation or action item be for you if you could?
Boy, that's really hard to first take back.
You can take about that and get back.
I mean, at the end of the day, if we don't have a supportive home environment, and that housing, I mean, the cycle is going to be very difficult. So the supportive housing and the recovery, the longer term rehabilitation and recovery are key items. You have to do the acute intervention stuff right up front, but we do that every day, and we're not seeing the outcomes that we want to see. It's that supportive environment, that housing, and, you know, the Lotus program is providing some really good evidence on that as well. So I think, you know, as a city, that would be, you know, the thing that I would focus on.
I know you got the answer.
Member Lefebvre?
Thank you. A few questions and some comments. We're a regional hospital, obviously mental health, regional hospital. You said there's 29 beds. What is
No, we have 29 beds at the Kirkwood
Yes.
site, and we have 31 here at the main site. So
Okay.
we have a total of 60 inpatient beds.
Okay.
Officially, but some days, you know, there's a few more patients.
then there? And what is the waiting list currently?
Well, for inpatient, there is no waiting
That's
list,
right.
but depending on your programs and services, mental health and addictions is a broad category. So, you know, there's waiting lists for many of our programs.
And how many of those are outside of Sudbury?
Mental health and addictions, majority of the treatment is local.
Okay.
Our regional programs, like, you know, I always use that like 34% of the patients that are admitted today at HSN are not from Sudbury.
Yeah.
But the programs that derive that are really things like what we call our regional programs, like cardiac programs and neurosurgical programs, our surgical services. So yeah, 1/3 of the population in HSN today is not from Sudbury.
And I think it's important to differentiate to the population the difference between what we're talking about here and recovery beds. Can you maybe explain recovery beds versus what you're talking about?
Yeah, so what we do at HSN is acute care.
Mhm.
We provide acute intervention for mental health patients. Dr. Coca, a psychiatrist who has ability to form patients and involuntary admit patients for treatment under the Mental Health Act is a key part of the work we do. So that's the acute care, but we also provide a huge community-based program. We have a large outpatient psychiatry program, but as well, we provide many other services from, you know, patients, PAC teams for patients that have severe mental illness and acquired care, eating disorders, other programs. You don't need to hear them.
Because what we're seeing often is like the high risk individuals that have been banned from the soup kitchen, they've been banned from shelters, and those are the ones that are cycling through. Numbers that I've heard from the SBS and from the hospital, maybe there's 15 to 25 of those individuals that cycle regularly through our system, and they, like I said, they've been banned from all those other services because of their violent nature or they're just not well. But right now, unless they decide they want access to services, if they do decide and Lotus is full, or like, will they get services tomorrow?
I don't know if they get services tomorrow, but they would get services, they would be put on a wait list for sure, but if they were, the teams would prioritize them for access.
And because what we're hearing from other communities is that a lot of the small towns around us, because we're the regional hub, they don't have at all in those services. They have no, so they are sent here. So my other question is, if they are sent here to receive services, once their services are done, they've been helped, or they check themselves out, they don't want services anymore. What is the pathway that they go back home, or what happens to them after that, after they're released from the hospital?
Yeah, well, they'd be referred back to the psychiatrist or
Here, Dr. Coca.
or to their family practitioner. They have a family practitioner for ongoing support. And some of the programs do reach out. Dr. Coca, as a psychiatrist, can speak to how he follows his patients across Northern Ontario.
Good, Mr. Chair and the Chief. This was a good report, and we agree what already David said that exceptionally well with the team here. Just before I came, I was with the ACT team, a circuit community treatment team. They said we have clone of some Officer Mills and things like that. They're excellent, compassionate, caring for our patients. I think we have inpatient beds wise, we manage, although there are sometimes people are waiting in the emergency department, but we manage to give them beds. When they come from out of course, our catchment area is big. We go up to Blind River, almost near Thessalon that way, to Werner, further that way, and then to James Bay Coast, sometimes. So I think when they come from outside of our catchment area, sometimes we give them the bus ticket and send them back after they're stabilized actively, care-wise. But some they say, I want to stay here, and some they have no choice. They go to shelter, they go to. I think as David said, if we have more of the supported living accommodations, as well as similar to Bruce Street, more Bruce Street plans are coming up. It is coming, like Lotus programs. We can do a bit better because they can stay there longer. Not everybody wants to go to the Lotus program either. I mean, I can give a couple of examples of ladies that I had the ACT team, also community treatment team, where it's intensive care for these people. We can see them twice or 3 times a day if necessary, my staff and psychiatrists, everybody. They left there, they didn't want to stay in home. They had stable home. There's one woman who has got money, 450,000 plus from this settlement. So we provide help to find a place. No, I don't want. It will be in the street and of course panhandle. But still, our patient, we can't force them to go into our housing. So this is the kind of people that we do come across. Addictions and medical services, of course, David said AMU provided exceptional service. We have people also in jail when, so the last part, we have psychiatrists that go to jail, provide service there if need be. That's only temporary service, right? I have also addiction medicine people going into the jail system also, some of the physicians, they provide support. But when they come out, they're out in the streets. That's what the paper from CAMH said that, say certifying them and that doesn't help us because when they come out under mental health act, we can only certify certain people and certain criteria, just like police officers, they can only, apprehend some people only, bring them to the hospital. So these are all the issues. I think province can do changes with the legislation, possibly, but I think we need more human resources, more services. Addictions medicine, again, in the community, we have the Monarch that provide addiction service. We work collaboratively with them, and we send people to Elliott Lake and other places for the treatment program, for residential treatment program. When they come out, then they support the need. When they come out, they don't have support systems. So, ongoing basis, support, more funding, more people to work. The Lotus program is working well. I think that we need more of that. I'll be happy to answer any questions.
Yeah, so thank you, doctor, and again, thank you to your team and all the all the work that you guys are doing to help this very vulnerable population. But on that point though, and that's, nearing comments, and certainly I'm a firm believer in supportive housing and more that needs to be done there. And certainly we're trying our best to do, and we need to do more. Now, that being said, it's when you identify these individuals that have access, that don't want it. And they often are the ones that are making decisions and creating social disorder. And like, that is the challenge, I believe, that we are facing now. So what I'm hearing from you is you don't have the tools to deal with that situation. Is that correct?
That's correct. Can't force them to go into some housing somewhere. Can't force them to come to hospital unless they're with a certain criteria.
I often say, doctor, that I can give them your house and my house with a fridge full of food and they still refuse it because they're not well and they need help. But yet our system lets them be in that state. That's where I think there's a major gap in our healthcare system, which is our social system as a society. We never had to deal with that before. Now here we are. I've done that to help these individuals well. I don't want to be helped. I want to continue because they're not well. That to me is the crisis of our time at this point. So I think it's important that we continue to advocate for more supportive beds. To do that, more resources on the healthcare sector, possibly made some changes to the legislation to allow the system to help these individuals out, sometimes because they're not well enough to make those decisions. That's a controversial topic. It is very controversial. Some doctors agree, some doctors don't agree, some police agree, some don't agree. It's very, very divisive right now. But whatever we are doing, this is my opinion, Chair, but it's not working for certain individuals. For some that want help, do everything that we can. Those that don't want help, right now there's a major gap because they are using police resources, healthcare resources, and they're just continuing and they need help. And it's just not normal that they're banned from the soup kitchen, they're banned from the shelters, and we let them be. That is not what should be happening in our society. Sorry, go ahead, Dr.
Okay. Again, housing is most important. I think that I had suggested in the past, maybe if we have 8 to 12 people in some housing units, then with some staff support for the mental health people, that might be helpful. But of course, we have to go to the root cause from the school system. That's where that we're trying, so that in years there might be some solution doing those kind of work in the school system, prevention-wise. But I think these people they need, and also energy port. I mean, I don't know. I got my own wild ideas. Whether we can put them somewhere safe in some place, then we can put some support systems for them. At least they're not in the cold and fire hazards and things like that. I'll leave it to the city. They come up with some, we'll be able to support their necessary things.
Be fair to Member Lefebvre's question, Dr. Coca, if our mandate of a board is adequate and effective. One of the stars of the system is Tyler Campbell, who works for you. Tyler heads up a very difficult mandate and does an excellent job and is a strong advocate for the Lotus and for housing, and his voice is heard, not just within Sudbury, beyond Sudbury. I think there was some, and again, I'm going to suggest this is more of a rumor mill, but on any given night, there's 300 homeless people in Sudbury. And out of the 300, 250 are likely open to help and support. But the other 40 or 50, to the examples Dr. Coca and Mayor Lefebvre you made, they really don't want the help. So I guess the question becomes, if it's adequate and effective in terms of policing, can we apply that to adequate and effective to mental health? And is there some recommendation, and you mentioned it is divisive, but that in fact there would be some sort of involuntary treatment on the short term to at least get these people into the system, that we can do a better assessment with them? Because I think, Dr. Coca, you and I are best friends. We talk just about literally every day, and you've explained the complications of this form system, which is not easy to attain. And then when it's attained, it's on a very short-term basis. So should we be looking at a different legislative tool to help us treat these people that really resist treatment?
Yes, sure. Of course, it's up to the government, right? It doesn't happen overnight. Psychiatrists always advocated for more also. Our hands are tied down for addictions. We can't certify them and keep them in the hospital. Even if you force them sent somewhere for treatment forcefully, they will come out and use them. So they have to be ready. I'll just give you an example of one case. There were families spent up to $200,000 sending them to different treatment programs, for $20,000, $30,000. At the end of the day, come back still same because the person is not ready. So I think those are the things. Keeping them in the hospital or the jail system, non-certificate, I don't know to help. But
I don't think it's the incarceration piece. I think it's trying to get the folks to be exposed to treatment that perhaps if they were, they would respond better than if it's just a 72-hour form or something that basically they can hold their breath, wait till it's done and get back out. And I think if my memory serves me right in the political, likely Tyler would be our best reference to this, but when Ford ran the first time in his first election, he did talk about voluntary treatment with regard to provincial legislation. That seems to have disappeared a little bit, but I guess the question is, I hear, again, as the chair of this board, that the Alberta model is a good model, where you have a choice of either going to jail or going to treatment, but the choice is yours. So those wanting help will get help. Those that don't want help are going to likely have to be incarcerated. So I think there's models across Canada that could be looked at to see if they're applicable to us.
And if I can just, I know we've heard about housing, and housing is very important. And you've heard me say, the trifecta. We often see those that have mental health issues, have addictions issues, and are unhoused because of those two things. And so when we talk about housing, it is 100% supportive housing, because we've seen landlords in this city no longer take individuals because they've flooded the apartments. Right? So the individuals, if we're talking about housing, they also have to be, to your point, Member Lefebvre, is provided with, services and supports for addiction and mental health. And so again, the $1 million question is, what does that look like? And just, I want to clarify, Chair, involuntary or incarceration. Don't forget, we have to incarcerate only when there's criminal activity.
Right.
So they're two totally separate issues.
So being next to Al Sizer, the oldest person in the room.
Every
Like,
time, eh?
right, every time, Al. I actually once upon a time sat on the National Forum for Health for Jean Chrétien. He actually chaired the committee. And after we reviewed coast to coast to coast with regard to healthcare in Canada and the model for Canada, the biggest determinant of health was housing. Okay, that's 25 years ago, folks. So this holy grail, this unicorn that seems to constantly come up in conversation is not a new idea. It's an old idea that can't get funding. Because again, even building the housing, and we have municipal people in this room right now, to get the builders to build housing that's going to have a minimum return on their investment is a challenge in itself. So therefore, I think this is a lot bigger issue than today understanding adequate and effective. Housing is the top of the list on many different regards. And I think, Chief, you've already said that's one of your 3 principles. Vito, you said it's very important. David, you said it's very important. So again, if there's any message from this meeting beyond the policing adequate and effective, and we have great leadership in this room right now, that very much housing has to be a priority for federal and provincial to be able to build the housing that people can occupy. And I think that is a real challenge. I think Sudbury, not to be patronizing to our mayor, to Councillor Sizer, you're making a real effort with the Peace Tower, with issues with regard to trying to get developers to make affordable. I know at the end of by Geneva House, at the end of St. Raphael Street, Jack is building that large, which was just featured in a local media. So we're making some initiatives, but I think somebody at the end of the table said it doesn't happen overnight. So I think from today's meeting, we'll certainly talk about housing. David, I'd like to come back to you with regard to, and Member Lefebvre kind of made a comment to it. There's lots of good people trying to help. I've been involved with the Elgin Street Mission for 20 plus years. Joffrey founded the food bank. There's issues with Go Give. There's issues with regard to leadership in the community and social services. I know back when I was vice chair of the cancer system, Cancer Care Ontario decided that one of the positions was something they called a navigator, and that when the person got the cancer diagnosis, they were assigned a navigator. That navigator wasn't a medical person. That navigator actually sat down with the cancer patient and the families, said, this is where you're going to get through the system. This is the shortcut. This is where your family's going to get counseling to increase the efficiencies. If we have multiple people trying to help the vulnerable population, do we need a navigator? Do we need somebody who would be assigned to actually say, we're going to help that person understand where the food is, where the clothes is, where the shelter is, where the counseling is, where in fact they can get some help for their families? Because I have families call me, the boat people that are panhandling outside my door, and can you go talk to my son because we're worried they're going to overdose? So is that a possibility that we get a navigator?
We have navigators in the hospital, when the emergency services, they come, the navigators for the addiction services, navigators for mental health, and navigators for the.
Do they go to Energy Court?
So through the city.
Yeah.
So our officers often on speed dial will call through Tyler Campbell's team, the client navigators, and they very much, again.
And are they the same ones as HSN?
No,
They connect.
But
They're connected. So
They're connected.
I think,
But
Chair,
is that a redundancy though?
no, they still, they can collaborate with each other, I think, that's Chair, you mentioned about the Alberta model. Of course, if we get the Alberta model, they don't need hospital beds. They'll be somewhere in the community
That's
treatment programs. We have the Monarch program here, 3 months, 6 months, they can also extend it, stay there, but we don't have enough beds of that nature. So if we have more services that can be provided in the community, what you mentioned, even portfolio, I'll go to jail, I'll go to treatment program, if the legislation is there. That is possible, that can be helpful. We can have some support system from our system, I guess, healthcare system. So it's always possible. Only thing is, we need resources, more people.
Always more resources. David?
Yeah, and I guess I'm addressing the issue of involuntary treatment for this intractable population, right? As Dr. Cook has identified, I mean, this is an important and evolving public policy debate. It's not only debate here happening at the police service board. The evidence, the best evidence that we have is through NH, and it is with in relationship to the population that does demonstrate that, yeah, when people are in incarceration, they actually improve. Because you're changing significantly their environment, right? This long-term success is debatable in terms of what happens to those people in the long term. We don't have that model right now in anywhere in Ontario, and it remains a matter of debate, and the evidence is mixed, as Dr. Gomes identified, whether or not it's effective. But it's not a tool that we have that's available to us. The push from a healthcare perspective is around quick access and important access to assessment, treatment, and then the supports that follow. But involuntary treatment is not a tool that we have available for this population right now, and the legislative framework of Ontario doesn't support it right now. But I don't think it's an issue that we can back away from, because as identified, patients are harming, they're dying, and there is options for care. But I would just let you know the evidence is mixed in terms of.
Just before member sides, there's a question. Previous presentation I've heard you make, David, we keep talking about the drugs, but you mentioned alcoholism is a more significant addiction in our community than drugs. Is that true?
Well, alcoholism has been a significant challenge. It's a leading cause of mortality and morbidity. The much more of a hidden issue, but the acute drug opioid crisis visible on the street is what's in the public eye. But alcohol-related illness and mortality is again a significant problem of Northern Ontario and some other communities across.
Because the intoxicated drunk people, the folks on the side of the room, have to deal with them, and some of them are very unreasonable. That's again a reality of daily life in Sudbury, and not just Sudbury, elsewhere too. Member Sizer?
It's interesting. There's lots of discussion, lots of solutions that could be offered type of thing. But I think one of the things was, we were talking about Dr. Coca and Chair Lahey was about the community and the organizations that are available to help these individuals. I'm going to throw this over to Mayor Lefebvre, Member Lefebvre, in that the city has our Community Safety and Wellbeing Program, which is trying to, I don't know if it's called centralize or trying to make it easier for individuals to navigate the systems that are available. There's a whole bunch of organizations, and where does the individual go to get that?
And
That help.
That's going on right now with HSN and our client navigators at the city. And it's been going on for a few years now. The ACT team is another part of that as well. So there's a lot of efforts, and I think that goes to Mr. McNeil's comments earlier that we're very unique and that coordinated approach. That being said, it's helping out some individuals, which is, we're seeing success. And then there's a pathway through the Lotus program or other programs that they want to access. We're seeing a much better coordinated approach. So that's going to continue for sure. Again, it's a bit innovative compared to other communities, but I think we're actually, when I meet with other mayors, they actually ask about our program and they want to know what we're doing here because they hear about it through our hospitals and other organizations.
And finally, the last comment, Chair, if I can, if you'll indulge me, is we heard again so many topics to discuss. The supportive housing is certainly one that is so necessary. We understand that around this table and in this room, we understand that. I'm showing perhaps my political colors in this respect, but it's unfortunate that the 1971 study in Dauphin, Manitoba, with the guaranteed annual income was not finally completed and assessed as to what the effects were of that annual income, which allowed people to afford housing, where they were given, I'm sure people are aware of it, they're given X number of dollars a month to live on, and it's deducted. So Chair Lahey gets his $2,000 a month, but of course then he has to claim it on his income tax at the end of the year. But I wish there had been more of a study done, and we talked about it in Hamilton for a short while with Premier Wynne with a program with an annual income, provincial annual income. So all that preamble, all that talk to say that that annual income, I think, would assist in the upstream solving of some of these issues, because not having a home, being homeless, probably starts or could initiate some of the issues that we're seeing manifested downstream.
Thank you, Member Sizer. Member Poland?
Member Sizer, I'm impressed that you can cite a study from 1971.
Because you weren't born.
The year I was born. But somebody else has got a great memory here, and that's Chair Lahey. So help me out a little bit on this. I think I recall that a number of years ago, we started a partnership with public health and with your predecessor, Chief Pedersen, to look at the opioid crisis. Am I remembering correctly, Mr. Chair?
Yeah, it was
Or
at
do you need to-
Steelworkers, it was at Steelworkers Hall. That was kind of that summit they started out.
Okay, so now that my recollection is at least close, thank you for that. We've heard from the hospital mental health. Where does public health fit on this issue?
So do you want me to address? So right now, we do have a community drug strategy. So we have a community safety and wellbeing strategy led by the city. We also have a community drug strategy. Community drug strategy is being largely led by public health. Chief Cunningham and I sit on, as the chair of the executive committee. I've actually been recently forced into chairing the substance abuse stream of the
Congratulations.
thank you. Substance abuse stream of that community drug strategy. So that's very much largely public health role right now in terms of really playing a facilitatory role in project management and support. So that's where they're sitting right now in that work. I'll sit on the executive committee. Like one.
Yes, and so, public health is a community partner as well. One of the things I want to comment on is we're often, when we say support first, and some of our community partners will say, well, have you referred, client so-and-so to us? Unfortunately, our officers often when we're engaging with individuals, especially in the downtown, and Member LaFave, you've said some of those very acute individuals that our public is seeing, they're not in a position to be accepting any referral, right? So that's where sometimes we'll reach out to our client navigators. But again, these individuals are, in a state of, intoxication, mostly by drugs. And unfortunately, the pathway right now is to the hospital to make sure they're medically, but we've often seen individuals leave before they're even medically assessed. So, I often use the term, and Tyler, you've heard me say it, this wicked problem. It's such a massive problem that, we didn't get into overnight. We're not going to get out of overnight. But it's definitely going to take so many legislative changes, numerous things that are going to support us, sitting here and our friends at public health to have better tools to be able to actually, get to these individuals that definitely need some help. And if that's an involuntary treatment for some time, that might be it, because they're not in a position to make these decisions for themselves to get out of the kind of situation they're in.
Chair Lougheed, if I may comment, I think we in our community, we're fortunate to have a different organizations who work collaboratively, CMHA, First Nations Services Clinic, as well as also their police officers and ourselves all work together. But of course, as you said, we need more resources maybe. And Heart Hub is another new one that also helps to identify and see how they can be supported, all of these patients. But again, addictions and opioids seem to be the big one, although alcohol problem is still the highest problem. But the addictions, because of the number of deaths we come across with all the crises that we come in the city, that's where it seems to be highlighted.
So, any other comments, Al? Krista?
No.
Sean? Paul? So, thank you, David. Thank you, Ryuta. Very much appreciated. We're not done.
Oh, but
Trying to get out, right?
well, I thought like I'm kicked off.
Stay at the big table. So, Chief, just a bit of a summary. The reason I called this meeting, full disclosure, is that I know everything we heard today and all the good stuff that you do and all the things that you folks do. And I don't think at times we're acknowledging and let alone appreciating, because again, as somebody who has a property in the central of all the problems, the police officers are always compassionate, supportive when you have to try to move people along. And it is a sad point, Chief, from moving from one place to another place to another place, but that's the reality of what's happening downtown right now. You guys do an amazing job. And you know what? I think it's to the whole credit that everybody participates, Chief, including you. You mentioned you and Acting Deputy Mark Burnett, but I was going through a parking lot with Pat Marios, and Inspector Norman and Inspector Rella have shoplifters in the back of the unmarked car that they're arresting, all right? And then, Matt, I was in the bank. The lady says, "Oh, the police never come. And they were vandalizing my car. The police never come." And I said, "Well, wait a minute. Here's Matt Hall's name. Give him a call, and I bet he'll talk to you, etc." The lady called me back because somehow she recognized me, and she said, "I talked to the guy. I feel better about that." Like, those are the stories that aren't getting in the paper. Those are the stories that aren't on radio or television. You guys are doing the best you can under really some adverse conditions. So if nothing more from our board, I think it's a bit of an understanding, yeah, it is adequate and effective, and we very much appreciate what you're doing. Because morale has to be something in this building as well. And if every day you go out, every day you get beat up, every day the loudest voices that shout the loudest are trying to make the narrative all about their problem, I don't think it's fair. So that's the reason as chair, and I'm on my way out anyway. Our next chair can take leadership however Sean wants to do that, but I thought it was very important in these last few weeks in particular. Ryuta tells me all about the issue with the Lotus, etc. Dave, you're a remarkable CEO for the hospital, and I'm aware of that. But I think we all needed to be in a room to hear about what another's doing. So rapid fire, Chief. What are you doing about panhandling? Because I get calls about that all the time. Panhandlers are out there again. What's GSP doing? They're doing nothing. You know what? They sit in their cruisers and they eat donuts and they never go to get the red lights, all right? I think you told me that you watched a whole week and there was no panhandlers in Paris and Brady Street. Is that true?
Now we've taken back that intersection. Thank you.
But that's not a headline. No, okay. How about shoplifting? I guess you can go into any LCBO or any confectionery, any Quick Mart, gather up any of the potato chips or whatever you want and just walk out. Is that true?
Sometimes, yes.
But do the police come when it's,
We sure do.
thank you. Can you say that again?
We sure do.
You come.
Yes.
All right. And is it just a downtown problem or the counselors in the other areas that have other neighborhoods and subdivisions and issues? Are you just doing all your resources downtown? Or are you trying to help the entire community?
We're trying to help the entire.
And so if somebody in the other part of the community calls, police officers do show up, right?
That's correct, yes.
Good. You can thank me after the meeting, Chief, all right? 'Cause as the chair of the board, that's what I hear, and I know it's wrong. And that's why I indulge everybody for an hour and a half this morning to understand that we're doing the best we can. And if you got solutions, and by the way, for the record, people that are leaders in this community, which I will not say at this meeting their names because everybody in the room knows them, says, Jerry, it's really easy. Get a bus, pick them all up, take them down to the old Burwash because there's a building there and put them all in the Burwash and it's too far for them to walk back to town. So there's the solution. All right. I don't think that's a solution. I don't think it's compassionate. I don't think it's supportive. And I think it's kidnapping. All right. And I think likely it violates everybody's charter of rights. But some narratives in the community have really quick issues about, just arrest them. I had another person call me last week. Fill the jails. That's Ford's problem, not your problem, Lockheed. Just to have them arrest everybody, fill the jails, and when you can't get any more people in, then tell the government to do something. Like people have some solutions which create great social media conversations, but are not reality. And I really want to commend the word compassionate and supportive. Because I fed a lot of hungry people over 20 years at the Elgin Street Mission. And my father was on the Salvation Board literally forever, and I know about food banks a lot. And the fact of the matter is we have a very caring community. So let's not change the narrative from the people we can help. And then the ones we can't help, let's still keep trying to help them with other tools in the toolbox. So there's my little rant and rave and a little sermon on a Monday morning. But I wanted you guys to hear that because you're doing a good job. So thank you. Anybody else want to say something? Got a motion, by the way. It's a big, long motion. So we're all good? All right. Let us read the motion. Whereas the Greater Sudbury Police Board and the Greater Sudbury Police Service recognize the concerns raised by community members regarding open drug abuse, property crime, vagrancy, vandalism, trespassing violations, violent crime, and social disorder in the downtown core and across the country. And whereas the board and service understand the community members, business owners, employees, and visitors want and deserve to feel safe in our community and expect visible action to address behaviors that affect public spaces. And whereas officers remain actively engaged on a daily basis in the downtown core to focus on both public safety and community safety with a compassionate approach and enforcing the law and holding offenders accountable where applicable. And whereas officers continue to take proactive enforcement action through the initiatives such as the bail compliance and warrants apprehension program. And whereas officers are working closely with businesses, loss prevention personnel, community partners to address property crime related offenses and shoplifting. And whereas these proactive enforcement efforts have identified and apprehended wanted individuals located in the downtown. And whereas the Greater Sudbury Police Service has dedicated strategy to work steadfastly with community partners, the City of Sudbury, Downtown BIA, Go Give, service providers, businesses, residents, which is having a measurable impact on calls for service, social disorder, open drug use, homelessness, violent crime, weapons, related calls, and suspicious person calls. And whereas the Greater Sudbury Police Service and its HSN, mental health, and addiction service partners continue to respond to the significant impacts of addiction, mental health crises, and homelessness as a collaborative community response, however, are restricted by individual rights to refuse treatment and limitations within their respective legislative authorities. And whereas despite significant efforts, certain individuals refuse and have the right to refuse much needed treatment despite being at risk to harm themselves and others. And whereas the mandate of the Greater Sudbury Police Service Board is to ensure adequate and effective policing. Therefore, be it resolved that the Greater Sudbury Police Service Board fully supports the Chief of Police and the members of the Greater Police Service in their efforts to address issues related to homelessness, addictions, and mental health crises through a visible downtown presence, enforcement action against criminal activity, and responses to criminal concerns that build a safer and healthier downtown. And further, that the Greater Sudbury Police Service Board openly deliberate meaningful discussions with all levels of government and partners on an urgent priority basis to develop solutions and regulatory authority to address these chronic issues through treatment interventions and intervention for legal violations. Further, that the Greater Sudbury Police Service Board requests the Ontario government to enact legislation that provides for involuntary addiction treatment, which would include assessment services, stabilization intervention, treatment and follow-up support for individuals who chronically place service demands on police, accessible and affordable housing, social services, and healthcare system. And further, that the Greater Sudbury Police Board supports the increase in funding from senior levels of government to programs and service for necessary treatment, support interventions to maximize outcomes and return. Moved by Member Forche and seconded by Member Poland. Any discussion on the motion? If not, all those in favor? And to be noted that it carried unanimously. Thank you, Dr. Coca. Thank you, David McNeil, for participating. Thank you, Tyler, for being here to kind of witness our adequate and effective comments. Thank you for all of you. Continue to do the good work. And we'll have our next meeting, which is our regular meeting in September 16th, 2020. Is there anything else that anybody wants to bring up? 2026. Living in the past, Paul. 2026. If not, I declare this meeting adjourned.
Present day.
Yeah.
There's a lot of.
Thank you.
Nice work.
I know.
Where's this one picture? No.
Yeah.
How are you doing? Good.
Are you?
Thank you, sir.
Too quick. A couple things out.
Yeah, that's why I give it back to you. Yeah. They were not in favor of the single entrance.
You took that. Yes. Thank you, Sharon. Oh, you're welcome. Yeah, thank you. So blue first and white. Blue first and white.
Okay.
Blue then white. Yes, yes. Everything good?
Yeah, what about yourself?
Good, good, good. Yeah. Looking forward to the next couple of days. We've got our final interviews, so
Oh, for the,
director of
Okay.
service.
and some good,
We have some good candidates. Like we interviewed a couple of weeks ago, we interviewed 11,
okay,
and we're now down to 5. So
the second interview?
I want to let them answer.
Oh,
second
wow.
and final. Yeah, so today they're actually in person. They're coming in. Yeah, she's
Okay.
one of them. Yeah, there's Leslie.
Yeah, and actually, supervisors.
Yeah, like there's kind of a.
Oh.
I'm gonna say.
Audit. Yeah. So.
Anyway, so she's the person who did it.
Yeah, for sure.
Yeah, it's, any one of us can see. This is my father, this is mine.
Yeah, 100%.
Really. I'm really excited that.
Your mind's just like always.
Fantastic. Christina's gonna be.
Oh, yeah, I think she's
I
gonna,
think she's gonna be.
when is she gonna, when she's,
Yeah, so it's been a little bit back and forth, but full time in the chair on November 1st.
okay,
But she's gonna be starting. So
Okay.
her job is 40% election, 60% legislative.
Have a good rest of your holidays.
She will. That's coming next Monday. Next Monday? Oh, okay, yeah. And then the next week, like a couple days. Okay. And then 16, it's quite busy.
That's for the election, right?
The election.
Okay.
So I just said, and then I said to Susie, how much notice they have.
I'm fine here. Meeting was afternoon.
Thank you, Doctor.
Thank you, Dr. Coca.
Thank you.
It's so good to hear
Yeah, we
from
can
you
do
again.
I'm getting started like this. Holland.
Yes and no.
I always think if we could check out it's sort of like rooms that are facilities or bathrooms. It's accessible.
I'll get out, those blocks right there.
Yes.
So we're talking about.
Yeah. To your point, bathrooms. Support of housing and bathrooms.
I know.
There,
No,
shopper, as well, and then also.
My patient is active.
That is a.
Until we can provide a place.
How much office?
That's the problem.
In that one slot, because they don't. Most offices over there.
We want to offer any of that, but
It's a body posture. And they do not follow. Like, I'm telling you, I'm not. I think it's actually. It is sweet. Don't take over. Like, I don't understand.
I know.
Just to this period.
And I'll go, move that to the and then by the time they back, they're back at the same spot. So I'm just moving around in that. So, which 40 hours are 70.
I have these people that don't understand finances, just income quotes that present something embarrassing.
See a lot of people in the island.
Property.
Yeah, I think it's.
Yeah, gone.
So far, yeah.
So then that's.
Good to see you, David. Thanks for your comments. I enjoyed it.
Thank you, sir.
Good job.
Yes, thank you very much.
Thank you. So, two more.
So fast. Money of it.
I think Dr. Coca knows his way
Yeah,
out.
yeah.
But,
Maybe it's like. Oh, no, that was explained to me after another source. That's just
Dr.
my.
Coca, I know you know your way out. You're on the board so long, but Mark's gonna take you and Dave.
That week, or I would.
Or combination.
Or rip down.
Every
Or
hour.
almost punched it. And that's
That's the other thing. Too. I want
I've been pushing stuff. Asking for them to be harder. Or whatever.
But when put it on the top, put it on.
Sorry about that, but no, I appreciate it.
And again, that's something.
I'm doing it after you.
Okay, so, all right.
Emily knows it more charging. Their city run housing.
Not really.
So they'll do more of that. Which they're,
Oh,
which they're,
great.
but at the end of the day,